Parham Doctors Hospital Joint Replacement Center. Your new lifestyle with a total knee replacement. In the comfort and familiarity of your own home, you can now continue your recovery and literally take new steps to an improved lifestyle. When you begin walking, your knee may be slightly stiff and sore, but after a few minutes, you'll be much more comfortable. Here are some guidelines to remember. When you first get home, use your forearm crutches or walker. As you get stronger, you may use one crutch opposite your surgical knee. Bend your knees as you walk and use the heel-toe gait you learned in the hospital. It is a good idea to walk every 1 to 2 hours during the day, gradually increasing the distance. You may go for walks outside as soon as you feel comfortable. Have someone with you the first couple of times you venture outside. Watch for slipping or tripping hazards. Walk on flat, even surfaces when possible, and avoid grass or gravel-covered areas. When climbing the stairs, place your good foot, the non-operative leg, on the first step. When going downstairs, place your crutches and operative leg on the step first. Remember, going up, good foot first, going down, operative leg first. When you sit, use a straight back chair or a rocker with arms. Bend your knee at a 90-degree angle when sitting. Bend your operative knee along with your other knee when getting out of the chair. If you have too much swelling in your operative leg, spend additional time in bed with your leg elevated. Do not sit on a sofa or a deep cushioned chair, and do not sit for more than 45 minutes at a time. You need to rest in bed at least 1.5 hours in the morning and 1.5 hours in the afternoon every day. It is good to have a nightstand table nearby on which to place your crutches. Rest with your legs elevated. Place one pillow under the calf of your leg, not under the operative knee, keeping your knees straight. This will help decrease or prevent swelling in your leg. You should also use ice on your knee to reduce swelling. Remember, toes higher than your nose with knee straight. While in bed, either before or after resting, is a good time for you to do foot pump exercises and straight leg raises, quad sets, heel slides, knee extension, and short arc quad exercises. In doing straight leg exercises, you should raise your leg 8 inches from the bed and hold for a count of 5. Remember to keep your leg as straight as possible. To get out of bed, bend your knees and use your hands to push yourself into an upright position. You may take a shower if your incision is not draining and you're able to get in and out of the shower. You may not take a bath, only showers. Just let the water run over the incision. Do not scrub your incision. If your incision is draining, call your surgeon's office. Use an elevated commode over your standard height toilet, as long as you need for comfort. Generally, when you are walking safely and confidently, you are okay to drive. Please make this decision carefully and consult your physician or therapist to guide you. For low cars and bucket seats, a pillow or two should be placed in the seat. For all cars, slide the front passenger seat back as far as possible. Place the seat in a semi-reclining position in order to provide plenty of leg room. To get in the car, turn your back to the car with your legs touching the door frame. Reach back behind you for the seat and slowly lower yourself onto the seat. You may find it helpful to roll down your window and use the open area to get up and down. Do not forget to fasten your seatbelt. To get out of the car, unfasten your seatbelt. Move your legs out of the car first and use the door frame to push up and out of the car. You will be able to do some things once you arrive home. Your coach can help with meals, bathing, walks, and entertainment. From now on, when you visit the dentist or your other doctors, it is important to inform them of your joint replacement. You will be given a joint replacement identification card when you are discharged. Be sure to take this with you and always show it at your appointment. Before visiting the dentist, we may recommend that you take an antibiotic at the time of your appointment to prevent infection in your new joint. You can get this medication by calling your surgeon's office or from your dentist. A serious complication of lower extremity surgery is blood clots. Clots can break loose and travel to the lung. Your surgeon will prescribe a blood thinner or anticoagulant to take at home. Follow the surgeon's directions. Side effects are possible with any medication. If you notice any of the following symptoms, stop taking your anticoagulant and call the surgeon's office immediately. Increased incision drainage. Bloody or black tarry stools. You may have black stools if you take iron supplements. Coughing up blood. Nosebleeds. Bleeding from gums. Vomiting blood or material that looks like coffee grounds. Bloody urine. Pain medication will be prescribed for you to take home. Some common side effects you may notice from your pain medications are nausea and constipation. Make sure you have eaten something at least 30 minutes before taking your medication. Eat plenty of fiber and drink 6 to 8 glasses of water each day unless you have a medical reason not to do so. When you finish the prescribed pain medication, you may take Tylenol or extra strength Tylenol as directed on the bottle. If your pain is not controlled with your pain medication, rest and apply ice. If your pain is still not controlled, call your surgeon. If you need additional pain medication, call your surgeon's office during business hours. There are additional symptoms that you should watch for. Drainage from your incision or worsening redness around the incisional area. Increased swelling that does not decrease with elevating your legs in bed. Dramatic changes in your lower leg size. Increased calf tenderness. Increased pain. Fever greater than 101 degrees. Persistent nausea and vomiting. No bowel movement in over 3 days. Your surgeon may order visits by a home health nurse. The nurse is there to answer any questions that you may have. Your vital signs will be checked. The nurse will check for signs of blood clots. The nurse will also check your incision. If you are going home after discharge from the hospital, your surgeon may order physical therapy visits if needed. Walking and completing your exercises are important for recuperation following surgery. Unless you have an emergency such as chest pain, or you are unable to get your breath, or an emergency that requires a rescue squad, call your surgeon for any concerns. Our surgeons like to talk to you directly or see you in the office regarding routine post-operative concerns. We at Parham Doctors Joint Replacement Center are here to help you with your new joint. Please feel free to call us with any questions or concerns. We believe that your joint replacement will greatly improve and enrich your lifestyle.